Okay, fine. Hello everyone, welcome to Unacademy Future Doctors. I'm myself Dr. Dipti. I'm MD PhD Physiology. I'm Associate Professor and I'm educating MBBS Nursing Physiotherapy as well as MD students. Okay, I have more than 17 years of teaching experience. First of all, I would like to tell you that in this channel we are posting videos for first year MBBS Nursing Physiotherapy and Dental and Homeopathy students. So if you have anyone in your group, those who are planning to take admission in all those classes, these videos will be very much helpful for them. Okay, now, so let me explain in brief about our subscription. We have two kinds of subscriptions. One that is plus subscription. In plus subscription, you can have you can choose the best from the best. Here you can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access question bank, which is having more than 25,000 questions. You can compete in the live test as well as quizzes, and with 12 months and above subscription, we will provide you notes also. Okay, now next is our iconic subscription. Here in iconic subscription, you can have access to best from two of the best. And which are these two? They are one that is Unacademy and Prep Ladder. With Unacademy, all the features I have already discussed. And second one that is Unacademy and Prep Ladder with Prep Ladder. Okay, here the features are you can have all the resources of 2021 Dream Pack, including clinical and integrated essentials. You can have video lectures from the Dream Team. You can have question bank 3 with active guidance, system tags, and much more. And you can have rapid revision, snapshots, treasures, and 2021 Dream Notes. We also have added certain features in our special class, and they are we made the class interactive and live. Okay, also you have a facility of raise a hand. You can talk to your educator in between. You can poll for the learners too, as well as you can never miss a class as you're always notified for your class. You can get lecture notes, you can download PDF notes and get access to the recorded classes too. Okay, and you can attend your class anywhere and at any time. Okay, now next is also we have updated and highly effective question bank, and this question bank is having more than 25,000 high yield questions, and these questions are based on latest exam pattern, and also it includes detailed explanation too. Also, these are our NEET PG 2021 September toppers. Also, we have Unacademy Medical PG test schedules. You can see here we have free test rituals as well as plus batch rituals too. We also have started our Focus FMG 2022 comprehensive batch that was from 15 December 2021. That is for 6 months. And second, that is Target NEET PG 2022 batch that was started from 15 December. That is for 3 months. Okay. Now, also you can subscribe from your mobile. You can subscribe any duration, and we have also facility of installments too. You can use my code Dipti10 and you will get 10% extra discount. Okay, now let us start with today's topic. Today's topic, that is properties of skeletal muscle. Learning objective of my today's topic. We will discuss following properties. They are, we will discuss property that is excitability, second property contractility, third property refractory period, and muscle tone. Okay, so these 4 important properties we are going to discuss today. Okay, now, so starting with first property, that is excitability. What is excitability? Excitability means in response to stimulus, you can see tissue gets excited. So response of an excitable tissue on stimulation, that is the property of excitability. Okay, so response of tissue to excitation, response to stimulus. Okay, response to stimulus, this is excitability. Okay, now What is stimulus? Stimulus, that is any change in the external environment. If there is any change in external environment that brings response or that produces excitability. So stimulus, that is any change in the environment that brings response or excitability in the tissue. Now, these stimuli are mainly of 4 types. Number 1, that is mechanical stimulus. Like suppose we are pinching mechanically. Okay. So mechanical stimulus, that is first. Second is electrical stimulus, like electrical shock. Third, that is chemical stimulus. Certain chemical substances also produce change in the excitability and produces response. Thermal stimulus, like heat or cold. Okay. Next is electrical stimulus is commonly used in the experimental purpose. Whenever we are doing experiment, we are using electrical stimulus. Okay. Now, what are the advantages of electrical stimulus? Why do we require electrical stimulus to be used? Why? Because they are easily handled. You can easily handle the stimulus. Okay. Duration of the stimulus, that is also can be easily adjusted. We can adjust the duration for half minute, 1 minute, okay, 1.5 minutes. So duration can be adjusted. Third, intensity adjustment, that is also easy. And fourth, that is it is least damaging. So these are the advantages. One, that is easily handled. Okay. Second, duration can be adjusted. Third, intensity can be adjusted. And fourth, that is it is least damaging to the tissue. Okay. Now, so you can see this way electrically we are stimulating, we are placing electrodes on the muscle or on the nerve and we can stimulate the tissue. Okay. Now, next is quality of stimulus. Quality, it has got 2 characters. Stimulus has got 2 characters. Number 1 is intensity and number 2 is duration. Now, what is intensity? Depending on intensity means less, more, highest, less. We have discussed. Depending on intensity, which is also known as strength of stimulus, there are 5 types of stimuli. We have already discussed. You can go through that class and you can easily attend that. You can easily come to know which are the different types of stimuli. Okay. So they are, number 1 is sub-minimal stimulus. Means it is less than threshold. It is less than minimum. Minimal, or it is known as threshold stimulus. Here this is less than minimum or less than threshold stimulus. Okay. So this is your sub-minimal stimulus. Okay. Then comes next is minimal stimulus, which is also known as threshold stimulus. Okay. So minimal or threshold stimulus, which is the stimulus required for the stimulation. You can see here, this is sub-threshold stimulus. Okay, this is threshold or minimal stimulus. Then third comes your sub-maximal, which is less than maximal, but more than, it is less than maximal, but more than minimal. Okay, so you can see here, more than minimal, this is the stimulus, but less than maximal, this is maximal one. Okay, and this is sub-maximal stimuli. Okay. Then comes your maximal stimulus. It is the stimulus which produces highest response. This is your maximal stimulus. Okay. And supramaximal stimulus. When the stimulus is more than maximal, it is known as supramaximal stimulus. The stimulus is more than maximal, but the response produced is not more than maximum. Why? That I have discussed. All the motor units are recruited here, so we are not getting the response which is more than maximum. Okay. Now, next is duration of stimulus. Okay. For how much duration the stimulus is applied. Okay. Here, if the stimulus is strong, then we require it to apply for short duration. Okay. But if the stimulus is weak, it is required to be applied for long duration. Okay. Now, this is one of the important topic. Next we are discussing, that is strength duration curve. What is the strength duration curve? Here, how to plot the curve? You can see here on the vertical axis. Here you can see on the vertical axis here we are plotting strength, and on the horizontal axis we are plotting time, or you can say duration. So strength and duration, we are measuring how much strength of current and for how long is it applied. As I told you, when the strength is more, less time is required, and when the strength is less, more time is required. Am I clear? So now you can see here, from this diagram you can easily understand this is the strength is highest 5 millivolts, so time is least. When the strength becomes 1 millivolt, you can see time required increases. Okay, so now we will discuss certain definitions may be asked from today's class or this topic, strength duration curve or excitability curve, and they are: one, that is Rio base. What is Rio base? You can see here this one. Rio base, you can see here this one. It is the minimum strength of current which is required to stimulate the tissue. You can see here, suppose the current strength is less than this, tissue will not give any response. So this is minimum strength of current, Rio base strength, which is required to stimulate the tissue. Okay. Second definition may be asked from strength duration curve, that is utilization time. What is this utilization time? It is, you can see, when Rio base strength of current is applied, how much time required, this time is utilization time. I repeat, what is Rio base? Rio base is minimum strength of current which is required to stimulate the tissue, this one. And utilization time is minimum time required when strength of current is Rio base. Okay. Third, very important definition from strength duration curve, that is chronaxy. What is chronaxy? Chronaxy means when strength of current is double than Rio base. You can see here Rio base is minimum current. Okay. Suppose I require 1 millivolt current. So to stimulate the tissue, that is Rio base. Now chronaxy means here we have to apply double than Rio basic strength. Okay. So when double than Rio basic strength of current is applied, then at that time, how much time is required to stimulate the tissue, that is your chronaxy. Okay. So what is chronaxy? Minimum time which is required to stimulate the tissue when strength of current is double than Rio base. That is your chronaxy. Okay. Minimum time required to stimulate the current when the current is double than Rio base. Okay. Now, what is the use of chronaxy? Chronaxy is used to compare the excitability of two tissue. Means suppose one tissue requires 5 seconds to get excited, other requires 10 seconds. So you can say that which one is more excitable? 5 seconds. So compare the excitability. Here you can see, as I told you, less the chronaxy, more will be the excitability. Okay. It requires less time to get excited. Important other things. Chronaxy of skeletal muscle of infant. Infant's muscles, they are more excitable. So this chronaxy is 10 times more than skeletal muscles of adult tissue. Okay. So this is one of the applied aspect. Other is if the muscle is paralyzed. Chronaxy of the paralyzed muscle is always longer because excitability decreases. So chronaxy is longer. Okay. Then chronaxy in the nerve disease. Definitely excitability decreases. Here also it becomes longer. Increased temperature, excitability increases. So chronaxy is short. Easy way to remember is excitability increases, chronaxy decreases. Excitability decreases, chronaxy increases. Chronaxy in homeothermic animal, that is also shorter. Homeothermic are we all animals. We all are homeothermic, or also known as warm-blooded animals. So we have short chronaxy. Why short chronaxy? Because our excitability is more. Okay. Now, So this is all about first property, excitability. Okay. Second property, contractility. Contractility means whenever you stimulate the tissue like skeletal muscle, it contracts and it produces response. So response to the stimulus in the form of contraction. We have already discussed isotonic and isometric contractions. Isotonic contraction. Here tone remains same. You can see isotonic, this one. Tone or tension remains same, but length changes. Tone remains same. For example, suppose we are trying to lift something, we are doing flexion, so muscle length changes. Isometric contraction means length will not change. You can see here the person tries to pull the thing, it is not being pulled, so length will not change. Isometric, but tension changes here. Here tension changes. Okay, so this is isometric contraction. Example is pushing the wall. Okay. Now next is contraction time. Contraction time means total contraction and relaxation. Total twitch of muscle requires how much time? It is different in different species. Like in amphibian muscle, this requires 100 milliseconds. Okay, but if we talk about human being, this is 30 to 50 milliseconds. Okay, in amphibian it is 100 milliseconds, and in human being that is 30 to 50 milliseconds. In warm blooded animal it is less. Now based on contraction time, skeletal muscles are of two types. We have already discussed red muscles or slow twitch muscle or back muscles, and white muscles or fast twitch muscles like extraocular muscles, muscles of hand. They are fast muscle, they will contract fast, and also they get fatigued also fast. Okay, now so this is your second property. First property we have discussed excitability. Second property contractility. Third very important property, refractory period. What is refractory period? It is the time during which our muscle or any tissue does not show any response to the stimulus. Okay, you can see here after a stimulus or after contraction is over, there is some time during which muscle is not being stimulated, and that is your refractory period. Refractory period is of two types, absolute and relative refractory period. You can see here in this diagram. What is this absolute refractory period? It is the period during which any strength of stimulus cannot stimulate the tissue. Any strength, maximal, supramaximal, none of the strength. Okay. What is relative refractory period? It is the period during which muscles shows some response if strength of stimulus is increased to maximum. So here when we increase, normal muscle gives response to minimal stimulus or threshold stimulus, but in relative refractory period muscle gives response to maximal stimulus. Okay, so this is about relative and absolute refractory period. Now very important thing here, in skeletal muscle and in cardiac muscle this refractory periods are different. You can see in skeletal muscle this is latent period. So first half of latent period is absolute refractory period, and second half of the latent period is relative refractory period. Total latent period is 0.01 second. Okay, so first half is 0.005 seconds. Second half is 0.005 seconds. Okay, so these are your absolute and relative refractory period in skeletal muscle. Now I will talk about your cardiac muscle. In cardiac muscle, absolute refractory period is, you can see the whole contraction period, this much, 0.27 second. Okay, this is your absolute refractory period in cardiac muscle. And relative refractory period is first half of relaxation period, 0.27 second. Sorry, 26 seconds here. This is 0.27, this is 0.26 second. So you can see here how much longer is this refractory period. This is absolute is 0.005 and this is 0.25. 500 times you can see This is longer. Now, what is the advantage of long refractory period? Any stimulus comes during this in the cardiac muscle cannot be contracted. But here, when it comes, as we have discussed, multiple stimuli, they produce tetanus like this in skeletal muscle. This tetanus is not possible in cardiac muscle because cardiac muscle cannot be stimulated during this period. Any strength of stimulus comes, it will not be stimulated. Second advantage of long refractory period is cardiac muscle is cannot be fatigued. Okay, so these are the two advantages of long refractory period. You can see in the cardiac muscle, this is the diagram showing long refractory period. You can see here 0.27 second and 0.26 second. This is absolute, this is relative refractory period in the cardiac muscle. So they can never get fatigued as well as they can never get tetanized. Okay, so this is about your refractory period. Next is muscle tone. What is muscle tone? Tone is a state of partial tension. It is the state of partial tension in the muscle. Okay, it is the state of partial tension in the muscle. Okay, now this muscle tone is present in all the muscles. In skeletal muscle, this muscle tone that is present because of alpha and gamma motor neuronal discharge, and this is highest in the anti-gravity muscles. Which are anti-gravity muscles? Those who are working against gravity. You can see here flexures of upper limb. These are flexures of upper limb against gravity they are working, and extensions of lower limb. So these muscles, they have highest muscle tone. Now, how the muscle tone is maintained? In skeletal muscle, you can see here alpha and gamma motor neuronal activity that is responsible for the activation of muscle tone and maintenance of muscle tone. Whereas in the cardiac muscle itself is responsible. Muscle itself generates its own rhythm. So through muscle itself, there is tone. And in smooth muscle itself, as well as it also depends on calcium ions and cross bridges. Okay, so these are also responsible for muscle tone. So in skeletal muscle, because of alpha gamma activity, cardiac muscle by muscle itself, and smooth muscles, calcium ions and cross bridges. Okay, now next small thing that we will discuss is what is the nature of voluntary contraction. Our voluntary contractions are subtetanic. Tetanus means the state of sustained contraction. So when the contraction is weak, they are subtetanic. But when the contraction is strong, what happens? More and more motor units are recruited. So the contraction becomes tetanic. Okay. So this is about your properties. Now I'll revise names of the properties we discussed. Number 1 is excitability. Number 2 is contractility. Number 3, that is refractory period. And number 4, that is muscle tone. These are very important properties of skeletal muscle, may be asked in your exams. Okay, now these are all the questions. I am not going in detail today. Tomorrow in our special class, my special class is at 2 p.m. Okay, tomorrow on 15th January at 2 p.m. Link is there in the description box. So all these answers we will discuss in my special class. So please go to the app, unlock the special class using my code Dipti10. You can unlock the free special class. This class is free. So I request those who are watching my video, please, for all these answers, you can watch my special class. Okay. Link is there in the description box, as well as I will share on my media also, that on my channel too. Now, so let us discuss just questions. Write down properties of skeletal muscle. We will discuss all these question answers in my special class. Okay, I am not discussing answers here. Second, what is excitability? Third, that is what is stimulus? Which are the different types of stimuli? Fourth, which stimulus is used for experimental purpose and why? Fifth, what are different types of stimuli according to intensity? And sixth, write down the method to obtain the strength duration curve. Six, what is Rio base? What is utilization time? What is chronaxy? Write down its clinical significance, clinical importance. What is contractility? What are the different types of contraction? What is contraction time or total twitch time? What are the different types of muscles according to contraction time? What is refractory period? So this is all about today's topic and questions. For answers, watch me on my special class. Open the app, right, enter my code Dipti10 and you can watch this free special class that is scheduled tomorrow at 2 p.m. Okay. Some other questions just added. What are the different types of refractory period we have discussed? Write down duration of refractory period in skeletal and cardiac muscles. What is the importance of long refractory period in cardiac muscles? What is muscle tone? How muscle tone is maintained in different muscles? What is the nature of voluntary contraction? So these are all the questions. Thank you. Thanks for watching. If you have anyone in your family or friend who is appearing or who is going to join medical, physiotherapy, dental, please share this video with all those, and that will be very much useful to them. Okay, if you like my video, you can like it, you can share with all your friends, you can subscribe our channel Unacademy Future Doctors. Thank you. हो रहा है